Stories about heroin addiction and overdose deaths seem to be in the news every day. Suffolk County has recently introduced an intervention program to reverse the possible deadly outcomes of opioid overdoses. Robert Delagi is the Director of Pre-Hospital Medical Operations and Program Agency Director for Suffolk County's Emergency Medical Services. He's here today to tell us about this new program. Thanks for coming in today, Bob.
My pleasure, Rod. Thanks for inviting me.
Great. I mean, obviously, opioid overdoses are in the news constantly and really a source of concern for people. But there's this amazing drug, really, called Narcan. Can you tell us about it?
Sure. Narcan is a medication that has been around for many years. It is called an opioid antagonist, which essentially means that when somebody takes an opioid, it affects a portion of their brainstem, altering their mental status, behavioral changes, and causing them to stop breathing. Narcan, as an antagonist, pushes that opioid off the brainstem and allows the brain to recover, increase respiratory rate, increase mental status.
Mm-hmm. So almost literally somebody will be unconscious, and depending upon how this drug is administered, they'll pretty quickly wake up and at least they may be foggy, but they'll certainly be out of the overdose situation.
They'll actually wake up within several minutes, depending on the absorption rate and the amount of substance in the body. But yes, it's very, very dramatic to see somebody who's not breathing or barely breathing and turning blue to almost immediately wake up, regain breathing, and in many cases mental status in a foggy situation.
Wow. And will this drug work only for opiates, or will it work if somebody, for example, is unconscious due to a Valium overdose or some other drug? What would happen if you administered this drug?
It would not be effective. It is only designed to target opioids. It will not affect any other drugs, medications, illicit drugs, but importantly, it will not cause any harm if you give Narcan to somebody who does not have an opioid on board.
So basically, if that person's unconscious, they'll just stay unconscious.
That's
at
true.
that point,
yes.
If you give them that. And you're using this drug in a variety of ways in terms of emergency medical services. I understand there's also an initiative with the police. Can you talk about that a little bit?
Sure. Traditionally, Narcan has been administered by needle, either intramuscularly or intravenously. And advanced level providers, paramedics, EMT critical care technicians have been administering Narcan this way for many, many years and seeing very positive results. Over the years, with increases in science and technology, we learned that Narcan is also effective when given through an atomizer, which in effect creates a spray or a mist inserted into the nose, absorbed by the blood vessels in the nasal mucosa, and distributed throughout the body. It increases safety in that our providers are not at risk for needle stick exposure in a high-risk population. And it also allows us to test the feasibility of having non-ALS providers, in other words, our basic EMTs, provide this life-saving drug, which is very, very time-dependent.
So up till now, only those that are trained as advanced life support individuals were able to use this. And you're talking about now expanding this to a variety of different people, emergency responders, including police, right?
That's correct. Mm-hmm. We identified a gap, and as I mentioned, paramedics have been doing it for a very, very long time. And in New York State, there is an organization out of the New York State Department of Health AIDS Institute and the Harm Reduction Coalition who have had a layperson training program since about 2006, where they would essentially train lay people to give intramuscular Narcan. So we took a look at that, and we saw that on one hand we had a layperson population giving the medication and a paramedic or advanced life support provider giving the medication. Many of our ambulances are staffed by basic life support EMTs, so we seek to fill that gap by providing this training to that subset of our EMS system. With regard to the police, many of our police in Suffolk County are in fact EMTs, and we recognize that police are on patrol. They cover relatively small sectors. They typically get to the scene first, so it makes perfect sense to take advantage of them by having them trained and equipped to administer this life-saving drug in a very, very timely fashion. We model this after an initiative that we've had here in Suffolk County since about 1990 or so, where we've had automated external defibrillators in police cars for much the same reason, very time-dependent technology. We also took a look that there are several other states, Michigan, California, Colorado, where intranasal Narcan is already in the scope of practice of basic life support providers, but not in New York State. So in order to change regulation and the scope of practice, we have to go through a process called a pilot demonstration project, which is currently what we're in now. In addition to the Suffolk County Police Department, we have the Quogue Village Police Department and 27 volunteer fire departments or ambulance companies participating in this program. I should also add that Suffolk County is one of several regions participating in this study. This program was actually established to provide this life-saving medication to people who are with people in high-risk behaviors. And there is also legislation on the books that basically tells people that if they are with somebody who overdoses, they should not be afraid of reprisal for calling 911. That we don't make judgment, we come there, we administer the medication, and people who call 911 should have no fear of reprisal in doing that.
Right, I believe they were calling that the Good Samaritan law, right? Mm-hmm.
And certainly, you know, we obviously advocate the use, and importantly, making sure that the person gets, you know, the appropriate follow-up care in the hospital and beyond the hospital.
And so it's a credit to our county that it sounds like everybody's beginning to work together. The EMS people, police, hopefully the chemical dependency people. I know that you've had discussions with some of our treatment providers known as Communities of Solutions about giving out referral information, perhaps.
That's true, and again, to combat that helplessness feeling when we leave somebody at the emergency department, there is a new trend in EMS where EMS providers can become community educators, and this whole notion of community paramedicine, which is working its way into healthcare in general as we go through healthcare reform at the federal level and the state level. EMS providers are going to be required to do more than just treat and take to a hospital. Prevention as an example. So anything that we can do to reach out to our clients, our patients, our customers is of benefit, and this surely is of benefit. While we might not reach everybody, at least we're trying.
Sounds great. So I guess to think about this, there's this drug that's been around for a long time that reverses overdoses that's now being used more frequently because there's a new way it can be used intranasally, and you're saving a lot of lives.
Yes, we are. Yes, we are.
That's great. If anybody wanted to contact you and get more information about this, how might they?
Sure. The easiest way to contact me is a telephone message at my office at area code 631-852-5080. Just leave a message. The staff knows how to get a hold of me, and I'll be happy to return phone calls within 24 to 48 hours.